Now, the Western Cape provincial government says it's concerned that the approaching Easter weekend may trigger a COVID-19 resurgence. In recent weeks, the province reported declining cases and hospital admissions, with a number of fatalities also on the decline. But the provincial government is warning members of the public against letting their guard down as this holiday season approaches. Health MEC Dr. Nomafrench Mbombo has appealed to holidaymakers to avoid large gatherings and to help the country avoid a third wave. In fact, she joins us now via our video link in Cape Town. MEC, good morning. Thanks again for your time on the program this morning. I mean, the Western Cape province has made so many strides in combating the COVID-19 numbers, infections on the decline, deaths on the decline as well. It would be a real shame if we do let our guards down for this Easter weekend.
Yes, indeed, Michelle. We don't want a situation where we ended up having the third wave being brought sooner. And also we know how the second wave affected us in December, where we lost as many healthcare workers, where many people have been hospitalized, and we have seen a high level of infection. With a variant, as we hear that 501YV2 variant is highly transmissible, although it might not necessarily be lethal. But we're also worried about the older persons that may end up getting infected, or those with diabetes, especially during the holidays, because it's when families gather, they hug, and even the young ones who are the mostly highly super spreaders, because they always gather, whether it's in the clubs or wherever. They will come to their homes where they are visiting, or even there where they are, and bring this high level of spreading among the older persons. Hence, we urge people, you stay in your bubble. If you can't, those gatherings are still allowed in the lockdown level 1. We say, please make sure that you keep the distance in that gathering, and also try to have all the meetings or gatherings, if you have to have gatherings, to be short, to be also within outside, and keep it small, not longer, because we don't know yet about the third wave. Taking note that also the upcoming winter season, which might have it towards, especially in the Western Cape, towards the end of April. It may mean that some people might also even get a flu, but we don't say that if you get a flu, you will have a corona as well. But when you have got many people who might be sick, especially with the respiratory conditions, and then you have got a COVID, so it does that put a high level of a risk to you. And then lastly, Michelle, not everyone has been vaccinated. Actually, the community hasn't been vaccinated. It's only the healthcare workers, and even among the healthcare workers, not all of them have been vaccinated. It means that the same principles, the non-pharmaceutical interventions that we have been preaching about keeping on your mask, washing your hands, and washing your surfaces, it still has to apply until at least more than 60% of our population have been vaccinated. That's when we can probably relax. But now we cannot be off guard in regard to the transmission, because not all are vaccinated. So I want to thank those healthcare workers who have been now vaccinated, and I've seen that even that high level of hesitancy initially that was there before people were vaccinated has gone. Now everyone must be vaccinated, but unfortunately, because of the availability and the limitation of the vaccines, which at this stage from J&J is part of the implementation study, the 1.2 million of the health workers that are supposed to be vaccinated in South Africa, only 500,000 could be vaccinated. And we're looking forward because I did hear that around May, the National Department of Health did indicate that they will receive other batches of vaccines, but specifically Pfizer, where we could start and complete vaccinating the healthcare workers, and also start with a high risk group.
Yeah, MEC, I want to talk about our vaccines in just a moment, but I want to stay on the story of gatherings, particularly ahead of the Easter weekend. I mean, you've outlined things that we can all do to help mitigate a third wave of infections. For one, stay in your bubble, and I suppose that would mean we don't travel outside of our provinces. And we know for the Easter weekend, when it comes to religious gatherings, people do travel outside of the provinces. I mean, are you advising churches in the Western Cape perhaps to bring their numbers down or in some way to help us mitigate a third wave?
It is difficult to ask people not to travel outside their provinces because it is still even a high risk even from one family and also to the other, even within the province or even within the area. Same applies that even when you have to go shopping at the malls where there are high level of the gatherings, it's also a part of where there's a high level of transmission. Same applies with the churches, because if you, like we allow 100 people inside the church, so if you're still outside your bubble, it means that you can all be infected. Same applies with the 215 that are allowed to gather outside. If they don't keep the distance, then it becomes problematic. So that's why we are saying that for each and everyone must take a responsibility, be it you are traveling outside the province, be it you are traveling outside your area or even outside your home, because you still, when there are more than 2 people gathering, it means that there will be a likelihood that there might be infection. Hence, we urge people that you still have to stick to the non-pharmaceutical interventions. I must say, Michelle, that I think what is worrisome is the uncertainty in regard to the variant and variants, because as we hear that they evolve and they keep on changing. So whilst we are looking at a 501.5V2 variant, which is highly transmissible, you'll never know the mutations and all of those, where you might have another variant, or this current variant might actually maybe just change and evolve and become something else. As I indicated earlier, that when we had in November started to have this high level of admissions at the hospital, nobody knew at the time that we have got the variant. We just thought that it's still about phase 2 or a wave to the second wave after the following wave. And we are now, lessons learned is about, now that the numbers are down, it means that between 2 months to 3 months, there might be another level of the third wave. So that's why we're saying to the people, now this is the Human Rights month, a weekend. We will have the Easter weekend, and then we will have the Freedom Day, plus also the May the 1st. So if you can see all of these holidays, they do bring about where people could be gathering together, even as family. As I indicated, that with the young ones, when they go out, when the bundles come back home, those hugs and also for cleaning the surfaces where they touch, it still needs to be applied. So especially to protect the older persons and also to protect those who are having diabetes.
Yeah, absolutely. So let's talk about the issue around our vaccination program, MEC. We know that we are lagging behind. I mean, initially our target was 1 million healthcare workers by the end of March. We're now at 182,000 healthcare workers around the country. What can you tell us from a provincial perspective, MEC, on the next few weeks? Are we optimistic that these numbers will improve?
It's not about people not coming forward to vaccinate. There are many people who are willing to be vaccinated. I'm talking about the healthcare workers. But we have to prioritize those who are high risk because of the limitation of the vaccines. The issue is about the limitation of